A lumbar puncture, also known as spinal tap, is a test used to diagnose certain health condition. It is performed in the lower back in the lumbar region. During a lumbar puncture, a needle is inserted into a space between two lumbar bone called vertebra. Then a sample of cerebrospinal fluid is removed. This is the fluid that surrounds the brain and spinal cord to protect them from injury. A lumbar puncture can help diagnose serious infections such as meningitis. It also can help diagnose other diseases of the central nervous system such as GBS syndrome and multiple sclerosis. A lumbar puncture may be used to diagnose bleed around the brain or cancer of the brain or spinal cord. Sometimes a lumbar puncture is used to inject anesthetic medicine or chemotherapy into cerebrospinal fluid. Why it is done? A lumbar puncture, also known as spinal tap, may be done due to collect CSF to check for infection, inflammation, or other disease. Measure the pressure of cerebrospinal fluid, inject spinal anesthetic, chemotherapy, or other medicine, inject dye known as myelography or radioactive substance known as cysternography into cerebrospinal fluid to make diagnostic image of the fluid.